Good morning, everyone. This is Colette Bird with the Oregon Health Plan Community Partner Outreach Program, and this is our CAWEM Plus training. Our agenda, we will first talk about introductions, talk through who's in the room. We'll provide an overview to CAWEM, which is our Citizen Alien Waived Emergent Medical Program. We'll talk about CAWEM Plus, billing tips, provider appeals, member appeals, resources for our providers and provider assisters, and then some frequently asked questions we've received on these topics. So as I mentioned, I'm Colette Bird, Provider Campaign Coordinator, and in the room we have
Napua Katros with CAWEM Plus Policy Analyst. Katie Baker, Lead Worker for Provider Services.
Great, and we don't have Antonio Torres in the room. He is our Community Engagement Coordinator. However, he did help with the development of this training and is also a resource to you moving forward. So let's talk a little bit about CAWEM and CAWEM Plus.
We're going to discuss the benefit levels. It's a benefit level of the Oregon Health Plan. CAWEM provides coverage only for emergency services. CAWEM Plus provides Oregon Health Plan Plus benefit package with just a few exceptions, and both are federal match programs.
So as far as eligibility goes, CAWEM, Citizen Alien Waived Emergent Medical, is available to non-pregnant adults and children who meet all the requirements for OHP Plus, except for the immigration and citizenship status requirements. Income limit is up to 138% of the federal poverty level. Folks who are eligible for CAWEM are not enrolled in a coordinated care organization, but instead remain on fee-for-service, or what we often call open card. In the provider web portal, someone who's on CAWEM would show as having the system code CWM. We have a little asterisk there on the screen, and that's to indicate that due to recent legislation, the individuals who are eligible for this program may change a little. We will talk more about that in the future, both in this training and then also in an additional training coming to you late fall, early spring, or late fall, early winter, excuse me. Okay, so CAWEM, what's covered? CAWEM covers emergency medical services only. As defined by 42 CFR or 40.255, emergency medical services covered are emergencies in the sense of a sudden onset of a medical condition manifesting itself by acute symptoms of sufficient severity, including severe pain, such that the absence of immediate medical attention could reasonably be expected to result in placing the patient's health in serious jeopardy, serious impairment to bodily functions, or serious distinction of any bodily organ or part. CAWEM does cover labor and delivery. So let's define emergency. As it's stated in page 11 of the OHP member handbook, emergencies are sudden illnesses or injuries that need treatment right now. Not being treated right away could cause severe problems or death. So examples of a medical emergency would be appendicitis or severe pain that won't go away with home treatment, broken bones, heart attack, bleeding that won't stop, etc. Examples of a dental emergency would be a tooth falling out, severe tooth pain, or serious infection. Behavioral health emergencies would include feeling out of control or threatening to hurt oneself or others. For pregnant individuals, OHP, including CAWEM, covers you and your unborn baby for true emergency care. And if someone thinks that they are in an emergency, they should go to an emergency room, of course, or call 911. OHP, including CAWEM, covers emergency care all day and night, every day of the year.
So Colette went over a few things that may be covered in a CAWEM situation, but a specific list can't be provided because of the complex situation. So CAWEM can be complicated due to the different caveats like HERC and matching the diagnosis and the CPT code and that sort of thing.
We do know currently what is not covered by CAWEM, and we can share that. We know prenatal or postpartum care is not covered. Sterilization, family planning, preventive care. We have a whole list of conditions and services that are not covered. However, due to recent legislation, we know some of these items will change and will begin to be covered in 2018. As I mentioned, we will have further training on these changes coming in the future, but we do want to call that out. And currently in 2017, these services and conditions are not covered by CAWEM. So shifting from CAWEM to CAWEM Plus, CAWEM Plus is available to pregnant women who meet all requirements for OHP Plus except for the immigration and citizenship status requirements. Income limit is a little bit higher than CAWEM, and that's 190% of the FPL. Like CAWEM, CAWEM Plus eligible members are not enrolled into a coordinated care organization and remain on fee-for-service or open cart. And in the provider web portal, CAWEM Plus members show as CWX as their system code.
The coverage overview for CAWEM Plus is preventative services, vision, dental, behavioral health care, labor and delivery, diagnostic services, prescriptions, and non-emergency medical transportation. And due to recent legislation, that may change soon.
CAWEM Plus, what's not covered currently, postpartum care, except when provided and billed as a part of a global obstetric package code that includes the delivery procedure, sterilization, therapeutic abortion, death with dignity services, and hospice are not currently covered by CAWEM Plus. And again, as we've been mentioning, this list may change come January of 2018, but we will provide more information as soon as we can on those changes. So let's talk about some billing reminders for providers when billing for CAWEM and CAWEM Plus.
One thing that's very important, always check eligibility first before you see the member. For instance, it's one of those days, institutional claims and the admit code should only be one. That's all we accept for CAWEM, and one is emergency. For professional claims, box 24A must have both to and from dates. Box 24C must have a Y for emergency. And box 24J must have both the NCD number on the top and the NPI on the bottom.
Slides 10 and 13 list exclusions, services that are currently never covered for CAWEM and CAWEM Plus members. OHP will never cause an appeal or redetermination to pay for excluded services, even if they're sought as an emergency service. Other OHP benefit plans or packages are subject to the Health Evidence Review Commission's prioritized list, otherwise known as HERC, and OHP General Rules, OAR 410120, which is the overarching rule for all of Medicaid's rules. When a service for a CAWEM member is not an excluded service, always indicate if the service was emergent. So on an institutional claim, like Judy said, enter 1 for emergent as the admit type, and for a professional claim, enter a Y for yes in the emergency field.
So let's talk about appeals. When providers and members may not agree with decision, there are opportunities to request an appeal.
And those, the claim revision mentioned an appeal for denial of payment allowed, limitation of payment allowed, prioritization decision, or overpayment determination for services provided to an OHP member.
And sometimes those are just due to a system issue or something that our policy unit needs to review, also known as a provider appeal. So provider appeals, an OHP enrolled provider may appeal an OHP decision in which the provider is directly adversely affected, including a denial or limitation of payment allowed for services provided, a denial related to a National Correct Coding Initiative or NCCI edit, a denial of the provider's application for new or continued participation as an OHP enrolled provider, sanctions imposed or intended to be imposed by OHP on the provider or provider entity, or OHP overpayment determination. It's also a situation where it needs to have a medical review, and we would then send it over to our medical unit.
Members can also appeal if an OHP member, including those with CAWEM or CAWEM Plus, disagrees with the payment decision. They can file a request for a hearing. So they must complete the request for administrative hearing, which is Form 443, or appeal and hearing requests for medical service denials, OHP 3302, within 45 calendar days of the date of the notice of action. On the next page here, just to skip to the very bottom, members who want to request a hearing can contact Client Services Unit for assistance as well, and they're at the very bottom of the screen. Otherwise, here at the top, we have the Medical Assistance Program rules, the general rules, links so you can view the different rules regarding these programs directly. We have OHP tools for providers, lots of good information for our provider partners. OHP forms, so where you can locate some of these different forms we've mentioned. Provider Services Unit is always there to assist our providers. And then our provider training team, we have an email address there for you if there are topics that you're looking for training on and are unable to locate adequate resources. You can reach out to the Medicaid training team to let them know. So we want to review some questions that we've received around CAWEM and CAWEM Plus. We'll dive right in. Is the form OHP 3165 required for CAWEM members accessing services that are not a covered benefit? And the answer to that question is no, since the majority of the medical services are not covered by CAWEM. And the rule is listed there for more information. Does a CAWEM patient need to be admitted to the hospital for an emergency room visit to be covered? The answer is no as well. Currently, CAWEM Plus does not cover postpartum care, correct? Correct, except when postpartum care is billed as a global obstetric package. How can patients on CAWEM Plus find a provider? So CAWEM Plus patients are open card or fee for service and may have trouble or may need help locating a provider that will accept open card or fee for service. And if they do need assistance, they can contact the OHP Nurse Advice Line. And we have the number up on the screen. They can also reach out directly to providers and ask if they accept OHP fee for service or open card. When will we find out how the CAWEM Plus covered services will change in 2018? As we've mentioned a few times today, we will have part 2 of this training coming in late fall or early winter, where we hope to address what those changes will look like for 2018. So stay tuned. Lots of work is underway to prepare for 2018. Once a baby is born to a mother on CAWEM Plus, is the baby automatically covered by OHP, or does the mother need to add the baby? The baby is not automatically covered. However, most hospitals do have a process in place for reporting the newborn to OHA. However, the mother or other parent should check that the newborn has been reported to OHA. If the hospital or other provider has not reported the birth, the mother or other parent is responsible for doing so. They could call OHP or work with an assister to report their newborn. Regarding CAWEM Plus, what is covered for medications? Can a client go to a pharmacy after a provider gives them a prescription? In general, the same medications covered by OHP Plus are going to be covered by CAWEM Plus. The patient can get a covered prescription filled at any pharmacy that accepts OHP fee-for-service or open card. What is covered for CAWEM Plus dental services? Are there dental services covered for CAWEM? For CAWEM Plus, and this is pulled directly from the OHP member handbook, we have basic services, dental services that are covered for CAWEM Plus, including cleaning, fluoride varnish, fillings and extractions, urgent or immediate treatment, crowns, sealants, root canals, on back teeth specifically for children under age 21. And then CAWEM covers only those emergency dental services. Okay, so what is next? One thing we know that is some recent legislation we'd like to share with you is around Cover All Kids. Senate Bill 558 was passed July 7th. You can view the bill online. We have a link to it directly. These changes take effect January 1, 2018, and enrollment will not begin until this date into Cover All Kids. And basically what's changing with Cover All Kids is that it expands Oregon's Medicaid program to include coverage for children and teens under 19, regardless of immigration status. The income limit for these children and teens will be up to 300% of the SPL for their household. Oregon is the 7th state in the nation to do this, so very exciting. We expect about 17,000 or so children and teens will be affected. And the Community Partner Outreach Program will be leading implementation. Many of you are familiar with I'm Healthy or Soisano, which continues through December 31st of 2017. And this program will transition to Cover All Kids on January 1 of 2018. There are some differences certainly between I'm Healthy, Soisano, and Cover All Kids. However, again, we will call out a lot of those differences and what to expect come January 2018 as we get closer and move into the fall. Additional information, including the enrollment process, will be coming soon. And finally, stay tuned for future CAWEM Plus trainings, where we will call out the differences in 2018 that will be coming to these programs. Thank you guys so much for your attention, and please reach out if you have any questions or concerns.